On behalf of Champion Entertainment, my name is Bill Cox, and this is Obamacare Review. Passed in 2010, the Affordable Health Care Act, Obamacare, is a national law with two main aims: making health insurance better for people who already have it, and getting health insurance for more than 60 million people who are uninsured. To do this, the law makes many new rules for private insurers such as Aetna and Blue Cross Blue Shield, public insurers like Medicaid, employers, as well as everyday citizens. This is, however, not a brand new concept, as it was piloted by Massachusetts in 2006 under then-Governor Mitt Romney. Approximately 160 million people, half of all Americans, already have private health insurance, and these are mostly bought by employers. For these people, Obamacare matters only if their plan is not all-inclusive. Under the law, insurers must now pay for many things that used to be optional, like prescription drugs, having a baby, and mental health care, among other services. The law also blocks any extra charges for routine checkups, cancer screenings, and other items. These new changes are part of the main reasons why companies are against Obamacare. This is because a majority of them made massive amounts of profits from these added extras. It's like buying car insurance and paying extra for breakdown coverage and windshield protection. Now, those of you who drive know that even if your coverage is fully comprehensive, having breakdown coverage is not a part of your plan and is not compulsory, and therefore not automatically added to your coverage. This means that if you want breakdown coverage, you have to pay for it. Now, the same happens when servicing your vehicle. It is all on you, the owner. Now, think of a world where your insurer, by law, has to offer you breakdown coverage, yearly servicing, as well as windshield coverage, free of charge, all as part of your yearly premium. Now, for us, it's great news, but for the insurers, not so much, as it means their overall costs will have to increase. Additionally, Obamacare also limits your yearly out-of-pocket fees, such as copays for going to the hospital. It also forbids insurers from kicking you out if you get sick. So gone are the days when you feared reporting any illness to your insurer for fear of losing or forfeiting your policy. Now, with this new law, they cannot do any such thing, meaning there is nothing to hide on the part of the general public. Another thing is that starting in 2015, workplaces with more than 50 people must provide insurance to full-time workers. So either companies will have to try and only employ 49 people or below, or they will have no choice but to insure all the full-time workers there. Another great win for the citizens, but not so much for the companies, most especially the big ones. Not only this, but very soon, your paycheck must show how much your boss pays for your health coverage, a revelation which may indeed shock you. Moving on to roughly a third of Americans on Medicare and Medicaid, for seniors and the poor and disabled, respectively. For these people, life won't change much for seniors on Medicare, other than having an easier time getting prescription drugs. However, Obamacare includes a big expansion of free health care for the poor through Medicaid. Starting now, nearly all families making less than $31,000 yearly could get free Medicaid, which means 17 million of the 60 million uninsured could be covered. Everybody else, the remaining 20% who don't have private insurance and don't qualify for Medicare or Medicaid, has to go and buy health insurance from an online government superstore called an exchange. You cannot be turned away, and depending on how much money you earn, the government kicks in anywhere from nothing to a lot to help you out. 22 million people of the 60 million uninsured will comply, still leaving about 20 million people overall without insurance. All this won't be cheap. So Obamacare cut payments to hospitals and created new taxes for rich people, medical device makers, and health insurers, among many other tweaks to fund the law. In the short term, the hospitals suffer as their funding has been cut. But in the long term, they will benefit as all the money coming through from the private insurers and government exchange will be coming to them. The biggest winners in all this are the American people. Finally, they don't have to worry about not being seen by a doctor because health insurance is too expensive. On behalf of Champion Entertainment, I'm Bill Cox.